warning, there has to be an issue, right? So, there's a big debate about fluoride. Is it good? Is it bad? So if you had tons of cavities in your mouth and you're not taking care of your health and you're just like whatever about life, then fine, use those toothpaste, right? But if you're actually trying to get optimal health, then there's other toothpaste with hydroxyapatite or betadine clay that you can use that are more natural, right? Because you don't need the fluoride, because your teeth are strong as itself.
All right, guys, got Dr. Jigar Gandhi here today. We're going to talk dentistry, right?
Yep, absolutely, man. It's going to be great.
Yeah, and a lot of modern day dentists are kind of using outdated methods.
Correct. So the goal is to try to get dentists to start changing their methods and starting to think outside of the box and start to basically think about the whole body instead of just the teeth.
So that brings me into my next question is, what exactly is biological dentistry?
So in biological dentistry, we're taking a look at the whole body. Right? Patients come in, they have their medical history. So instead of just being tooth doctors, well, you injured this one tooth, let's just go fix that. Let's take an overall look to see what's going on inside your mouth and is it affecting the rest of the body. Teeth are connected. We know that there's science is out there. But if we can go beyond just saying, hey, let's just fix this one tooth, let's just fix this, let's look at everything all together.
Right.
And that's the event of biological dentistry.
So if you have a cavity, what other areas of the body would that impact?
So a cavity is majority of the time is localized if it's small. If it gets larger or gets into a nerve, now you can affect the rest of the body, right? Because the bacteria can get into the jawbone, and once it gets into the jawbone, it can spread. So that's the goal is prevention.
Yeah.
Right. If we can be preventative, then we wouldn't have to go to a patient getting a cavity.
Yeah. So what are some preventative techniques other than the basic brush your teeth and floss and stuff like that?
Yeah. So number one is diet and nutrition, right? So if the patient has a good diet or nutrition, then less likely to get a cavity. And now because the nutrition is good, their whole overall health is going to be better, right? But the biggest problem with the standard American diet, patients are falling off of that. And now that's why more people are prone to cavities, especially in civilized societies. There's more dental decay than in uncivilized societies. So that's a big problem.
Right.
Right. Another thing is fitness. So now fitness, yoga, meditation, to get a patient out of what we call sympathetic overdrive. So if the patient is super stressed, they're going to grind and clench their teeth. Now, grind and clench, you're going to break a tooth. So now that's going to become a problem. So fitness, exercise daily, you can do meditation. There's a lot of yoga. There's a lot of other things to calm yourself down.
Right.
Yep. And then the other thing is oral hygiene that we talked about. So when you really look at timing in a 24-hour period, we have 1,440 minutes, right?
Yep.
And how long does someone really spend brushing their teeth or caring about their mouth? Like 2 minutes.
Yeah, if that.
Yeah, if that. Because it's like 30 seconds feel like an hour,
Yeah.
right? So we're just so quick. So if we could take a step back and really care about our mouths, care about our teeth, our gums, overall, the patient will start feeling better. And it's really like, look at it as 1,440 minutes in a day, and you're only spending 30 seconds to a minute. Right. That tells you a lot of they're not valuing their teeth.
Yeah. And now there's a lot of debate about the toothpaste, right?
Correct. So the toothpaste is huge. I mean, if you go to the back of the toothpaste and it says poison or call poison control warning, there has to be an issue, right? So, there's a big debate about fluoride. Is it good? Is it bad? So if you had tons of cavities in your mouth and you're not taking care of your health and you're just like whatever about life, then fine, use those toothpaste, right? But if you're actually trying to get optimal health, then there's other toothpaste with hydroxyapatite or betadine clay that you can use that are more natural, right? Because you don't need the fluoride, because your teeth are strong as itself.
Yeah. So why is a systemic approach necessary as a dentist?
Patients are sick, man. We're spending too much money as a whole, as America, spending too much money on healthcare, right? And dental care as well, right? So both. So if we can start with how is things getting inside your body, right? If we can start fixing the mouth and making sure that you're taking a preventative approach, then you might not have those health issues down the road, right? So we all want to live longer, right? I think after 2020, people have started to change the way they think and the way they're acting, the way they're taking care of their bodies. So that's one of the goals.
Right, and biohacking starts in the mouth. So I just had Dr. Pompa on last week.
Yeah, he's awesome.
Dude, he was saying even the mouthwash is like messing up your whole body.
So when you look at some of the formulas out there, I'm not going to name it, but it's green and blue, orange.
We know.
Yeah. So that's floor cleaner. I mean, the original way it started was
As a B2B marketer, you know how noisy the ad space can be. If your message isn't targeted to the right audience, it just disappears into the noise. With LinkedIn ads, you could precisely reach the professionals who are more likely to find your ad relevant with LinkedIn targeting capabilities. You can reach them by job title, industry, company, and more. Stand out with LinkedIn ads and start converting your B2B audience into high-quality leads today. LinkedIn ads allows you to build the right relationships, drive results, and reach your customers in a respectful environment. You'll have direct access to and build relationships with decision makers. 1 billion members are on their platform, 180 million senior level executives, and 10 million C-level executives. You'll be able to drive results with targeting and measurement tools built specifically for B2B in technology. LinkedIn generated 2 to 5x higher return on ad spend than any other social media platform, and you'll work with a partner who respects the B2B world you operate in. 79% of B2B content marketers said LinkedIn produces the best results for paid media. LinkedIn has been a great platform for me to also find interesting podcast guests. If you're interested, start converting your B2B audience into high-quality leads today. We'll give you a $100 credit on your next campaign. Go to linkedin.com/social to claim your credit. That's linkedin.com/social. Terms and conditions apply. LinkedIn, the place to be.
back in the 1920s when babies were being delivered in Europe, they were being born and moms were dying and the babies were dying because they weren't cleaning their hands.
Wow.
So they came up with this formula to wash your hands, and now the babies were surviving and the moms were surviving. And then all of a sudden that one becomes a mouth rinse. I mean, you can use it as a floor cleaner.
Yeah, that's crazy.
Yeah, I mean, naturally, if you wanted to use anything to brush your, like if you use a tongue scraper, use a copper one, right? Then brush your teeth, use whatever type of toothpaste without the fluoride in it, right? You're gonna, as long as you don't need it. And then you can use coconut oil pulling. That's going to give you healthy teeth and healthy gums.
I've been oil pulling. It's been massive. Because when I first started podcasting, you could actually go to my first episode. I had really yellow teeth.
God, oh wow,
Yeah.
This
So
changed for you. It works. It's just it's a slow effect, right?
Yeah.
But it does work over time.
Over time. If you do it every day,
Correct.
15 minutes.
Yes, that's the key. Like you have to do it for a long period of time, and that goes back to toothbrushing, right? So it's like if you're 30 seconds, then it's not going to work on you
For sure. Oh, my jaw used to hurt so bad the first month. I couldn't even do like 5 minutes at first.
Yeah, and imagine with the coconut oil pulling, right? You get this big jar from Costco.
Yeah.
You're saving so much money.
Yeah, it's like $10.
That's it, and it's going to last you a whole year,
Yeah.
or even 2.
Yeah.
Right? And it's organic, and you're going to be fine.
What do you think about the way dentists treat cavities just in general right now?
So there's tooth color fillings, right, which are great, right? As long as the bonding agents are done the right way, then the patient can heal. But the biggest problem with tooth color fillings, there's also BPA in them. So you have to get the BPA-free fillings, or the material, right? So that's a good part. But also when you're talking about metal removal, the biggest issue, if you're not taking the safety protocols, then you're putting yourself at harm, the dentist, the assistant, or anyone in that room, and the patient at harm. So you got to take the right protocols, a preventive approach for it.
Absolutely. So with the mouth being so close to the brain, is there a direct linkage there?
100%. So you got the trigeminal nerve, which is one of the big cranial nerves that are attached to every tooth. So each tooth is an organ. So we have to stop thinking of it as like it's just a tooth, right? You have 32 organs inside your mouth that are close. One of the closest organs to the brain. Your eyes are right there, right? And then you got the teeth there. So what happens is if bacteria gets inside the jawbone, right, it's going to make it's called RAT, or retrograde axonal transport. All that means is like if you pinch your finger, you felt it, but it had to send an impulse to your brain back and forth. So it's a highway. Think of a nerve as a highway. So those pathogens latch onto that nerve and end up in your brain and end up in the rest of the body. That's why they find bacteria, mouth bacteria, oral microbiome, or any of the bacteria inside your mouth, in your gut or the rest of the body. How to get there? It just didn't magically go from your mouth to somewhere else. It had to get a transport area. So that's where the nerves of the mouth. That's why it's such a sensitive area, and patients hate. Like people really don't like going to the dentist.
Yeah.
I mean, they've got to be serious, honest about it. It's because it's so sensitive and it hurts.
It does.
Right. So, but if we go step back and do the preventive approach, you never got to get there.
Right.
And you just got to go in for your cleanings, and then you're good to go.
Yeah.
Right.
What made you want to go that route? Because it's probably less money, right?
So it is less money, but there's so much to fix, right? There is so much dentistry to be done, right? But it's also the human being, right? The approach is mankind. I love humanity.
Yeah.
And the problem that I see right now is people are not living as long as they should. There should be no reason why we're not living to 100, all of us, right? Especially in America. We have everything we need and want, but yet we're living to the age of like average is 72 to 76, and we're so sick. So how can we reverse that? And that's one of the reasons why it's like the prevention approach came along.
Yeah. So let's talk about the battery effect. So what
Yeah.
exactly is closed circuit versus open circuit?
All right, so human body's a closed circuit, right? So as soon as you put something interfering, it becomes an open circuit, right? So when an open circuit, electrons can't flow, right? Body is negatively charged. We're energetic beings. So if you had a dead tooth in the mouth, a root treated tooth, or a root canal tooth, or a metal, depends what kind of metals you have. Now all of a sudden the body can't work. You have an open circuit, so the electrons are not flowing, and when electrons can't flow, disease starts.
Wow. So there's physical disease that could start from just having a cosmetic procedure done on your teeth.
Correct. More so not cosmetic, more so if you're in pain,
Yeah.
right? Because cosmetic, you're going in there, but you're 100% right on a cosmetic approach. Like if you go in there and say, hey, I want veneers, I want crowns done, you see a lot of patients going overseas and getting all this cosmetic work done. They're filing the tooth down. And now if the tooth is sensitive, what happens? Now you need additional work. So why touch a tooth when it's natural, right? So if we can keep something that's natural, then all of a sudden you're never going to have a problem.
Yeah, I was never a fan of veneers. I know a lot of celebrities and stuff get them to look better in movies, but it just seemed like they're really chipping away at your tooth.
That's the thing. You're grinding the tooth down and then you're pasting something on there. And then years down the road, you have to pay the price and say, now it's causing me trouble.
Right.
Or you just live with it and you're always living in an ailment.
Yeah. So let's talk about the 5 interference fields. So 70% of all interference fields in the body are in the oral cavity?
Yeah, absolutely. So interference fields are something that are in the mouth that are preventing the electrons to flow, right? It's called the battery effect, right? So the first one we can talk about is the bite, as we talked about veneers, right? So a lot of patients want veneers because they want to fix the smile.
Yeah.
But naturally, our teeth are beautiful. We're born with, right? We don't deal with a lot of staining, which we dealt with like patients in the 60s and 70s because of antibiotics. Very rare now, right? It does exist, but very rare. So if we can fix the bite, Invisalign or clear braces, we fix the way the teeth should align the right way, and then you can bleach them, whiten them, or use the coconut oil pulling techniques. All of a sudden the teeth get really light, so you got the cosmetic effect, right? But we're dealing with a lot of bite issues nowadays. And the other aspect of the bite itself is we're mouth breathers. And becoming a society of mouth breathers, our jaws are shrinking. And when our jaws are shrinking, there's not enough room for our teeth. That's why a lot of the wisdom teeth, some patients don't even have them. And the other ones are impacted, which cause a lot of issues.
Yep.
Right. So if we started becoming a society of nose breathers again, the jaw can develop the right way.
I've been working hard with that. I sleep with mouth tape now.
Yep.
Because all 4 of my wisdom teeth are impacted.
Got it.
But I want to do my best not to get them out, to be honest.
Yeah.
Because of just how the system is.
No, 100% agree. And mouth tape works great. And you feel better, right?
Yeah,
you wake
feel
up.
amazing.
Yeah. And the days you forget to sleep without.
Awful.
Awful.
It's
right?
noticeable.
Yeah. Yeah. And that's why it works so well. But now if we can take a step back and say, okay, well, you got a 5-year-old who's a mouth breather who's running up and down the walls, just put a little bit of tape on their mouth and all of a sudden they're sleeping well. They don't need all these medications.
Yeah.
Right. So that's another area, right? So we can go into the deep dive into medications and medicating our children, which shouldn't be there unless they truly need it.
That's a whole nother podcast.
Yeah. But the root problem is sleep.
Right.
Right. So you put a piece of tape on there and then all of a sudden parents are happy because their jaws are the kids' jaws are developing and they're saving tons of money on braces, right?
Yeah.
So because usually it's like, oh, a kid turns 10 to 13 years old or 8 years old. All right, now you need braces.
Yep.
So
I have those.
Yeah.
Yeah. But that may make you wear a retainer.
Correct.
Your whole life.
Yeah, because once you're shifting a tooth, it's gonna go back if you don't have the retainer.
Yeah. I lost mine. So.
Got to get another one, man.
You think so?
Yeah.
Well, now it's too late. It's been like 5 years.
Yeah. But you can still maintain that position, or
Yeah.
you can do the clear brace road and just get them to the right position and then wear the retainer. But
maybe I'll try Invisalign then.
Yeah, because then so you don't break any teeth. Because then if you break teeth in the future, then now you need all this dental work.
Right. I want to talk about metal teeth. I don't know if they're still giving those, but I know for our parents' generation, it's pretty common.
Yeah, so that's another interference, right? So that's metal. So when you have the silver fillings or the amalgam fillings, 50% of that is mercury. The biggest problem with that is mercury is one of the most non-radioactive toxic elements known to man.
Wow.
Right? So it's deadly, right? We all know it, but the research is out there for it. So the biggest problem with metals is it blocks the interference, right? So all of a sudden now if you had a metal filling on top and a metal filling on the bottom, saliva in the middle, you're getting a shock. It's like a 9-volt battery constantly. So there we go with the battery effect, right? So you're constantly shocking your whole mouth.
Jeez.
On top of that, if you had a metal crown adjacent to a metal filling or 2 different metal crowns, whether it's gold or the white porcelain material and metal underneath there, If you look at the gums look purplish, and that's also a shock to the gums. So we have all this metal inside the mouth that's causing all the interference fields and causing the whole body to go into haywire.
Wow.
Right.
And people don't even think about that.
They don't think about that, but when we show them photos, they're like, why does some patients will like, oh, my gums, why do they look purple? They've been living like that for so long. That's a problem.
So is it better just to get it removed completely then?
You get a ceramic crown.
Okay.
Right. If you need a crown is a full coverage. If you damage the top of the tooth and it's damaged, then you put a crown on there. It covers the whole thing. It's like a thimble. The
That
best
makes
way
sense.
to think of it. Yeah.
Is there a way to treat cavities without drilling, just naturally?
There's remedies out there. But if the gut microbiome has to be really good. They can't have really dry mouth. They have to go into parasympathetic mode. And then that's when healing can start to begin.
Oh, interesting.
Yeah.
Wow.
So,
because all my wisdom teeth have cavities right now.
Got it. So that's a problem there, because that will get deeper if it's not treated.
Oh, wow.
Yeah. So
I got to address that then.
Yeah. And also going back to metals, you have titanium, right? So titanium, if a patient's missing a tooth, they want an implant. Titanium, 99% of dentists throughout the world use titanium dental implants to replace a tooth. Just think of it like a screw that goes into the jawbone. Now, the problem with that is it's also conducting, right? So now you have a metal conduction inside the bone. And then corrosion happens too, because you have metal on top of another metal that goes into that implant. Now you have corrosion and inflammation around the gums. So we're trying to get rid of inflammation, right? Inflammation is the root of all disease. Every disease is known to man is inflammation.
Right.
Like when you think of diabetes, like when someone says they don't feel it until it's too late, even same thing with heart issues, right? So inflammation is, if we can downgrade inflammation, slow it down, you're going to have a longer life. Yeah, so those are the two interference fields. The other one that we can talk about is the microbiome, right?
Yeah.
The oral microbiome is huge, right? When we use some of these mouthwash and some of these techniques, we're wiping out the good stuff. The good stuff is actually the healthy stuff, right? So we need to keep that around. That's actually keeping us healthy. And then there's a linkage between the gut and the mouth, right? The biggest thing is the anatomy books only talk about the uvula, where the mouth stops and then the gut starts. But in reality, the whole gut, the entrance to our body and the entrance to our gut is through our mouth. So there's three ways we get something in our body, right? It's through an IV, through our mouth, or up the rear end where the sun don't shine, right? That's it.
Yeah.
So if we're getting all the nutrients through our mouth and our microbiome is good, there should be no interference field. But a lot of patients, their microbiome is off, so they can never get healthy.
So crazy. I used to use mouthwash every day, man.
Yeah.
Growing up.
Oh, we all did.
Yeah.
Until we found out the truth, right?
Yeah.
And then you find out, you're like, whoa, this is crazy.
Yeah.
You know, I can't believe it's that toxic. And that's literally what happens. It's really that toxic to the human body.
And the final interference field,
Yeah.
root treated teeth, right?
Yeah, two more.
Oh, two more?
Sorry, yeah. So root treated teeth. So those are either dead teeth, something like you got your jaw knocked when you're younger, a tooth that died out, but it's not causing you any pain, but you can't see the nerve, you can't see the middle part of it, or what we call the nerve area, the pulp, or a root canal tooth, right? So root canals are okay to have, right? It's a misconception, rip every root canal out. Some patients can live with them the rest of their lives. But the thing is, you need to know what's going on inside your body, right? It's your body, you should know, right? So if you had a root canal tooth, or what we call root treated tooth, and it has an area at the apex, or that's the end of the root, it could sometimes be a pea size or even larger. I've taken out such big infections, and patients are like, oh, I don't feel anything. The smell that comes from there is horrible. It stinks off the room, man.
Yeah.
And it's just like, it's the smell of death inside of your jawbone, and you haven't even noticed it. Like, they're just living their lives, right?
Yeah.
It's crazy. But so that's a huge interference field, and that is one of the things that really throw the whole body off. The last two, the root treated teeth, and we'll talk about the cavitation next, but that can throw your whole system off. You're talking about autoimmune disease, cancers.
Dang.
There's all connections between it, right? Dr. Pompa talks about it a lot because, I've spoken to him about it, but it's wild what's out there. And the patients can't correlate their systemic issues to their dental work. But I always tell the patient, all right, let's play detective work. Backtrack to when the last time you felt good. And the time after that, did you have any dental work? Okay, well, after the dental work, did you feel good? Majority of times, no.
Wow.
So we have ways of figuring out if it's actually coming from there. And if it's coming from there, let's go treat it.
Yeah.
Right. So those are the root treated tooth and dead teeth. That's huge. And then the last one is cavitations, right? With the wisdom teeth. In Western world, we deal with a lot of chronic fatigue and heart issues.
Yep.
Right. Chronic fatigue and heart issues, there's linkage where the wisdom teeth are, right? So the biggest issue is you get wisdom teeth out, that's perfectly fine. But if the socket, the bone is not cleaned the right way, that's a problem. So think of like the back of like your car if you go to the trunk and you push it, it's going to spring up and down, right?
Yep.
There's car shock. So each tooth has a car shock. We call it a ligament. It's a PDL, periodontal ligament. The biggest issue is when you take a tooth out, if you don't scrape that ligament and use the proper equipment to get rid of it, your brain still thinks there's a tooth there, but it's not. So now the body's going to falsely close, the gums will close over it, but inside the pocketing starts happening. So all the pathogens, and you're talking about bacteria, you're talking about viruses, fungus, and parasites. They're all just bathing in there.
That's disgusting.
Yeah, it's really disgusting. And it's like, it's one of the things they call Rantes and CCL5. If you just did a Google search over it, or PubMed, not Google, on PubMed, you'll see more than 5,000 articles relating to this issue.
Wow.
But it's in the jawbone, and that's all the cancers, Alzheimer's, depression, MS, all relating from this stuff. So let's clean it out. If we clean it out, then all of a sudden the patient's starting to get better. But again, not every patient needs this treatment. It's all selective. Right? It's patient specific, right? So that's the thing that we have to make sure. It's not like, hey, rip out every tooth, do every surgery, every metal needs to come out. No, if you're okay with it, your body can handle the toxic load, perfectly fine. If your body can't handle a toxic load, now it's the time we need to treat it.
Yeah, and that's probably hard to identify because you probably get the most fit patients that you wouldn't even notice like that an issue.
So that's the crazy part. The most fit patients are the quickest ones to fall because they don't have visceral fat. So adipose tissue or visceral fat is what can store these toxic levels of the toxicity, right? So now the biggest issue is when there's no visceral fat or adipose tissue, they have one thing done, their whole system goes haywire because they're so finely in tune to their bodies that one little mistake or one little thing that they did, all of a sudden they have a trouble.
Right.
So that's easy to identify. Now you're talking about someone who not taking care of their body, then it's more difficult to identify.
Yeah, 100%. Now you mentioned parasympathetic earlier to treat cavities, right?
Yeah.
So what's the difference with parasympathetic versus sympathetic?
Okay, so parasympathetic is rest and digest. It's where we want the body to go. That's where healing starts, right? So if someone is in fight or flight mode, constantly a tiger running after them, well, if a tiger is running after you, it's great to be in fight or flight. You need to run, you need to get out of there, right? But the problem is if you're in that 24/7, there's no way you're going to heal, even if we take the tooth out or whatever the interference field is. If we remove it, you're never going to get better, right? Your teeth are still going to be sensitive. You're still going to have aches. You're still going to have all these other issues. So if we can get you into parasympathetic mode, rest and digest, we know when we remove that insult or that interference field, things are going to start getting better for you. And your body can actually start to heal. So we always say, let the healing begin, right?
And can you reach that state pretty quickly or does it take some time?
When you remove the injury, you can reach that state pretty quickly. But the biggest issue is if you don't take me time, like if you're getting the surgery done, take some me time, take some time off. Like you're busy, with everything.
Stress.
And exactly. Patients are so they come in, they're like, oh, next week I gotta fly out, I gotta do this, I gotta do this. Or then they get on their cell phone, right? You're talking about like EMF waves, right to their area. It's like you use a wired headset, let's let your body heal. And once it heals, you don't end up with this injury where you have to go retreat it down the road. And that's the worst thing is the patient doesn't heal. It's the body didn't heal. The technique and everything was done to the right way, but it's the body that has to accept the work.
Right. Have you seen any linkage with cell phones and teeth issues?
Yeah. So with titanium implants, the EMFs, we have one patient who works on skyscrapers.
Yeah.
He's like, does the whole,
the
cranes.
Oh, the cranes.
Yeah. So he feels it. He's like, hey,
Holy
I feel an
crap.
antenna. So and it's also with metal fillings, the EMFs, right? They have the whole linkage of it because it's voltage, right? So if you took electrodes and put them on the metal fillings of titanium, you'll see the circuit go up.
Damn.
Yeah, so that because it's conducting, right? There is blood supply around it.
That is scary, man. Wow. People don't even know that.
No.
So what are meridian pathways?
So meridian pathways are energy flow. It's old school Chinese medicine where they use acupuncture, right? So each tooth has a meridian linkage, right? Some are connected to some meridians match up together. And that's what we use to diagnose, right? So it's not the firm set, but if a patient's having ailment somewhere in their body and it's linked to this area, then we know that it's a tooth causing it, right? But they work both ways. So if a tooth, all of a sudden, you're healthy and you never had a cavity, everything's good, all of a sudden, tooth starts to go haywire on you, then we can check the linkage to that meridian to see if that other area is going okay. And that's where we refer you to the right integrated medicine, functional medicine, or your primary doc to make sure everything else is okay.
Got it. So do you do implants at your office or do you outsource it?
So we do all the implants in-house, yeah.
Got it. Ceramic
implants,
so no titanium?
We still do some titanium, but majority we're gearing towards ceramic.
Okay.
Yeah, because we built the office from 2014. It was titanium. In the U.S., it was hardly anyone was doing ceramic.
Right.
The change started coming 2018, 2019. Then 2020 hit, and then all of us things took a step back for the whole country, and then everything started picking up. So one of the top providers for ceramic implants, they work great. It's just the way they heal inside the body. So when you talk about a metal conducts.
Yeah.
Right. And titanium is just not 100% titanium. There's aluminum in there, there's nickel in there, there's palladium in there. There's all these other metals as well. Even though 96, 98% is titanium, there's still those other metals in there. But you don't want aluminum inside your body. There's so much aluminum already in our air and everywhere else. Right? So that's toxic load. So with the ceramic one, you have something that's inert, biocompatible, and non-conductive. That's there, right? So is it the best option as long as the patient's healthy enough and their body's healthy enough to accept it? 100%. It's a single tooth replacement. It's the best thing you can have.
Nice. You mentioned inflammation earlier. Now there's two types, silent and chronic.
Correct. So silent inflammation is chronic. So acute inflammation, acute inflammation is something that you injure yourself, that's right away.
Yeah.
And then chronic or silent is next.
Got it.
And that's the killer, silent inflammation. You won't know what's going on. So the majority of patients will walk around inside their jawbone not knowing that they have disease until they come to the dentist who can actually read them. Right? We were talking about the wisdom teeth area. Like you get them out, you see it on the x-ray, okay, well, everything looks okay. But if we see what we call a radiolucent spot, meaning a light area around where the tooth used to be, we know that there's an issue there. So now it's like, okay, should we treat that area or do we not need to treat it?
Right. So that's a good scan everyone should get, right?
A 3D scan, every dentist should have a 3D scan, and every patient should have a 3D scan. Yeah, because that will tell us what's going on inside the jawbone.
Yeah. Let's end off with neural therapy, and I know you got some presentation too.
Yeah, absolutely. So neural therapy is basically where we'll inject some anesthetic into areas. So if you said, hey, this tooth has been bothering me, I don't know if it's like related to another body part, but this tooth hurts and somewhere else hurts too. So we could just inject some neural therapy. Basically, it's an injection of procaine or an anesthetic into that area. And what it does is it freezes that meridian. So it freezes that area, so it allows the meridian to free flow. And then all of a sudden, if the other area is feeling better, and then 4 hours, 12 hours later, it comes back because the anesthetic wore off, you know that's where it's coming from.
Right.
Right? Yeah. So that's the biggest issue.
Nice. And you're looking at that too. And then what are these documents you got here?
Yeah, so this was just to show you about like the inflammation, just to go over like the closed circuit, the sympathetic and the parasympathetic. Sympathetic. We can put a lot of these online on the website.
We'll put it on the video.
Yeah, just so all the majority of the references are there because, we get a lot, biological dentistry, it's like something new. So you want to make sure that we're following the facts, the research. So we're not just doing like, hey, I've seen this done, or maybe this work. It's no quack work. It's like, hey, this is PubMed articles, the research show this is the evidence, and that's how we're going to treat you.
I love it.
Yeah.
Where can people consult with you? You're only in New York right now?
Correct. In New York, in Long Island, New York. We'll put the website there. It's Shore, S-H-O-R-E, Smiles Dental, or ssdentalny.com.
Cool. Yeah. Anything else you want to close off with?
Oh, I love it, man. Thank you for having me. Man.
Yeah, I think it's very important. It's something people don't talk about.
Yeah, the word's getting out there. That's what I'm happy about. We did, I'm trying. Other dentists are trying because it definitely, it's educating the public, educating the patients. This way they know that there are other options. And it's not okay to feel not normal. Right?
Yeah.
So if you're seeking optimal health, definitely say biohacking starts in your mouth.
Yep.
You can do all these IVs, you can take all these peptides, vitamins, minerals, work out all you want. But if you keep falling off that cycle, you keep relapsing, definitely get your mouth checked out.
Absolutely. Yeah, because preventative health is getting bigger, but people don't realize dentistry is another form of it.
Yeah, it's the last part. It's crazy. It was a biohacking conference in Miami. And 4 of the presenters were talking about dental.
Wow.
Which is fun because there's a shift. There's a paradigm shift, which is what we need in this society. Right?
Absolutely.
So as soon as we have the paradigm shift, then the prevention will happen. They can do their biohacking and they have optimal health and longevity.
Doctor, it's been fun talking to you, man.
Awesome.
Thanks for spreading the message. Yeah.
Thank you, man.
Of course. Thanks for watching, guys. As always, check them out. We'll link his stuff below. See you next time.